Now, America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA, from Alaska to Florida, all the way to Hawaii. Our producer today, Mr. Darren Wilhite. I'm your host, Carrie Hall. This is your show, America. Thank you for joining us and making us one of the most listened to talk shows throughout the United States. We appreciate all of you out there. If you want to follow us, you can do that at America's Healthcare Advocate on Facebook and Instagram. And as I always tell you, all these shows are posted on the podcast platforms and on YouTube. And we're getting so many of these podcast platforms, so I'm probably going to have to stop reading these, but I'm going to go through it today. We're on Pocket Cast, Spreaker, Spotify, Google Podcasts, RSS Feed Podcast, TuneIn, Amazon Music, I don't know how we got on there, Pandora Podcast, Overcast, Stitcher, Listen on SoundCloud, and Apple Podcasts. So we're on 12 podcast platforms now. We got a lot of people listening to this on podcast platform. Today's show is going to be on two topics, and these are topics that you may want to tell somebody about and go up on that podcast platform and listen to. We're going to talk about Medicare Special Needs. This is a special product line that is available from certain carriers that RPS Benefits by Design services. We're going to talk about that and who qualifies and why. And this is important. This is information you're going to want to know. And the second thing we're going to talk about is we're going to talk about Medicaid and what's going to happen to the 15 million people that are going to lose their Medicaid coverage. That's what I just said, lose their Medicaid coverage in April of this year, because the omnibus spending bill had a provision to cut these people off of Medicaid. Now, here's the thing. 6.1 million of those people will qualify for an ACA policy at about $10 a month. We're going to talk about that and how you can do that. So this is an important show, and it's a show that you're going to want to make sure if you have somebody in that circumstance, you can tell them to go back up to the podcast platform and listen. All right, if you are looking for help with any of these things, I have in studio today with Marie Allers, Carol Lee Steele, and the lovely Joyce Thompson. Here today, and we're going to talk about all this stuff. They're available to you at RPS Benefits by Design. You can call them anywhere in the country at 877-385-2224. That's 877-385-2224. They are happy to help you. You'll listen to them talk about how they do this today and how it all works. So those are our topics, and that's where we're going to start. So let's just kind of start off with, Carol Lee, let's just start off with this whole special needs, the three areas where people can qualify for special needs. So you've got chronic conditions.
Chronic conditions,
okay,
correct.
So that's typically somebody that has diabetes or heart condition.
Or several of them combined.
Correct. And that so you may qualify for one of these plans under that condition. If you are in a nursing home, okay, or if you have an equivalent of that kind of home health care.
Correct. Institutional, which is actually for Medicare.
Okay. And then if you're on Medicaid, okay, if you're on Medicaid, you can qualify for one of these Medicare Advantage plans. That's a special needs plan. So we're going to talk about how you do that, what all of that is today. That's the first topic we're going to cover today. Then we're going to chat a little bit about, we're going to go into this ACA to Medicaid thing. But Maria, let's talk a little bit about, there's a plethora of ads out there. I watch a lot of YouTube. I watch YouTube when I'm in the gym. I like to watch the music shows and some of that stuff, The Voice and America's Got Talent and stuff. So I watch, and every like 8 or 9 minutes, there's an ad on there now for people what they're doing is they're telling you, hey, would you like $600 for groceries? What that is that's a come on for the Medicare special needs products. The problem is you're calling some national call center where they don't know anything about the part of the country you're in or what you're doing or anything else. What happens to those people if they sign up for that and then they call back 3 months later because they've got a condition or they've got a claims problem or provider problem they need help with? Maria?
Well, most of the time, you're not going to get much help from them because it is a national number. Whereas if you use RPS Benefits by Design, we really pride ourselves on that personal service of being able to help you with the claims. We have strong relationships with our carriers, so we can make those calls, advocate on your behalf. You can call the number that you mentioned, Carrie, 877-385-2224, and you'll get a live person.
There you go. A lot. Not 14 voice prompts, people, but a live person. That's almost unique in today's world.
Absolutely. It is unique. I mean, how many times have we called anyone and you're pushing this number or say yes or say no? But with RPS, you'll get a live person. And not only will you have one person able to service you, but we have a team of experienced account managers that service you. The experience on our team has carrier background, HR background, and then, as you mentioned, Medicare, Medicaid background, where we are able to provide creative solutions for our clients.
You know, and it's funny too because if you're an employer, you're a large employer or whatever the case may be, you typically get that kind of service. But when we're talking about somebody buying an individual Medicare special needs product, Carol Lee, or somebody who loses this Medicaid, which we'll talk about later in the show, for them to get actual care, for them to be able, as you just talked about, Maria, to be able to have somebody actually talk to them and help them, that's pretty unusual.
Absolutely. Benefits is not a fun topic that most people enjoy talking about, and it's overwhelming. So we walk you through the details. We understand your medical history and find a plan that is customized to you, that works for you and your family. When you call these national hotlines, they're not taking the time to really dive deep into what your needs are. And that's where we really specialize, is understanding your needs and what you need and the plan that fits for your family.
Yeah, and it's not moving. Let's get this done and move to the next sale. Let's get this done and move to the next sale, which is how these call centers work. So I'm spending time on this because I know you're seeing these commercials. They're on CNN, they're on Fox, they're on MSNBC. They're all over the place. Okay, it's just like during open enrollment when you see those commercials with Joe Namath and the former governor of Arkansas. It's remarkable to me, all the people that get to do these things. But having said all of that, it's the same thing. It's just a different product they're talking about now, but you're dealing with the same people. And I caution you in doing that, because if they get it wrong or if you need help after the fact, you're not going to have much luck in getting that help. So let's go back in, Carol Lee, to those three categories. So chronic conditions. So if you're on a Medicare policy, Medicare Advantage policy, because these are all Medicare Advantage.
Yes, they are.
Okay. In a chronic condition, you don't need to wait for open enrollment to do this, do you?
Correct. You can enroll the first 3 quarters of the year. You have an open enrollment season that you can go ahead and change plans should you need to during that time, which is different than the regular population.
Right. So if somebody has a heart condition, if they've got diabetes, if they've got type 1 diabetes, and there are other conditions as well. And so talk a little bit about that.
Well, there's so many additional benefits to the special needs plans that are not available for the average Medicare Advantage plan, and so it services them. For instance, even on the dual eligible plans for people on Medicaid. Medicare has so many moving parts just by itself, and then you add on another level like Medicaid or chronic, and then you have a whole nother issue with as far as benefits. There's whole different levels of benefits that are available to these populations.
And we're going to get into the benefits. We'll do that in the next couple of segments. But, I want to concentrate now on just telling people out there, we just covered 2 issues. If you're on let's say you're out in the rural community. There are a lot of people on Medicaid in the rural communities, probably more than there are in the urban communities on a percentage basis. If you're on a Medicaid plan and you don't have one of these Medicare Advantage special needs programs, they should take advantage of that.
Absolutely.
And when we get into the benefits on this, you're going to be probably a little surprised and probably a little shocked at the difference in these benefits and the typical Medicare Advantage plans. So those are 2 categories: Medicaid, chronic condition. Now let's switch gears and talk about somebody that's in a nursing home, okay, and how this works for them.
And not all carriers have that, but the ones that do, they actually target those 3 things: chronic, and then also in their institution, that's what it's called. And they've got special benefits specifically designed for that particular population.
And that also applies if you have that level of home health. if you're doing home health care, somebody's doing home health care, you're a caregiver, whatever the case may be, those plans are available to you as well if they demonstrate that same level. We come back from the break now. We're going to start getting into these plans a little bit and start explaining some of these benefits. I think you're going to be surprised by what you're going to learn. Stay tuned. We'll be right back after the break. If you want information, call Carol Lee, call Joyce, call Maria, 877-385-2224, 877-385-2224. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. Don't go anywhere.
Because it won't be long before our true love will be through. Whoa, tell me, darling, am I right? Am I right?
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. We're here to serve, and that's what we're doing today. We're talking about Medicare special needs, who qualifies for these. And when I tell you, when Carol Lee and I get into the benefits here and we start talking about this, you're going to get a real clear understanding of why, if you're a caregiver, if you've got a relative in this situation, or maybe you're a home health care professional that you've got clients paying out of their pocket and they can only get to you, maybe you can only go see them once a week or twice a week because that's all they can afford. If they're on one of these plans, that all changes. So we're going to talk about that in this segment. If you want information on that, you can call RPS Benefits by Design. You can talk to Maria Allers, you can talk to Joyce Thompson, or you can talk to Carol Lee Steele. And the number is 877-385-2224. That's 877-385-2224. They are there to help you. If you maybe you don't know, I don't know, maybe mom's going to qualify for this, or maybe my grandmother's going to qualify, or maybe Uncle Ned will qualify. Well, pick up the phone and call them. You heard Maria say this in the first segment. They'll walk you through the process. They will stay with you. They'll get you qualified. You heard Carol Lee say how confusing this stuff can be. It's very confusing, okay? But these folks are experts. They're CMS certified, trained, licensed agents that understand this stuff and understand how to do it. So Carol Lee, with that, let's kind of get into the differences between, let's contrast this with typical Medicare Advantage plans. So a lot of Medicare Advantage plans have zero premiums.
Correct.
But after zero premiums, what happens?
There's copays and coinsurance, and then out-of-pocket maximums. On the special needs plans, it's zero, and then most of the copays and coinsurance are zero as well. As long as they qualify for Medicaid, they have full Medicaid, and then they have Medicare. Some people say, well, I've got Medicare, and Medicaid pays what it doesn't, but they have no idea what type of benefits that they are missing out on with these special needs plans.
And they're leaving it on the table. And
Exactly.
That's the point we're trying to make to you out there. If you're on Medicaid, that's one of the three segments. If you're on Medicaid, if you've got a chronic medical condition like diabetes or heart, stroke, whatever the case may be, or if you're institutionalized, if you're in a nursing home, or you have equivalent home care, meaning you've got to have somebody come in and help you bathe, somebody dress you, somebody take care of your needs at home, well, then you may well qualify for one of these. So again, how do you find that out? You call these folks and they are happy to help you. But we're going to go through now because I want to illustrate this to you. So the monthly plan premium is what?
Zero.
Thank you. Annual Medicare deductible.
Zero.
Okay. Primary care.
Zero.
Zero. Specialist visit.
Zero.
Referrals.
None.
Right. Inpatient hospital care.
None. Zero.
Now here that
Zero copay.
correct. Now contrast that with the Medicare plan, because on the Medicare plan, Medicare Advantage, you're paying $250, $300 a day for what? The first
Days
month?
1 through 5, and then 6 through 90 is zero.
Okay,
Correct.
so here it's zero. Okay. Outpatient surgery.
Zero.
And again, on a typical Medicare Advantage plan, that's going to be $350, $500, something like that.
Correct.
Right?
That goes to your out-of-pocket.
Correct. Okay, and obviously there's an out-of-pocket, of which there is not here. Home health care.
Zero.
And that's a big one. So that's the one where I'm talking to you folks out there that, maybe your mother, I've got a very good friend with this. She is almost 90 years old. She absolutely irrevocably is not going to leave her house. So they've got home health care for her. she's on one of these plans. It makes all the difference in the world because they've got somebody able to come in and help her with her needs. You know, if you're that caregiver and you have to go take care of all those things yourself every day, that's going to wear you down. It's going to wear you out. It's a huge burden for people. Okay, this is a way where you can have this plan, have competent help, and make sure that your loved one's being well taken care of. Right, Carol Lee?
Absolutely.
Yeah, and that's one of the really good things about this plan. Lab services.
0.
And emergency care.
0 copay.
And that's another one that's a big deal. So if you wind up going to an ER, you're not paying a dime, you know, and that happens to folks that you got a chronic condition, you may wind up in the ER.
Mm-hmm. Absolutely.
Okay? Those are the kinds of things that happen that where you may have to go into an ER because something happens to you at 2:00 in the morning and you're not going to go see a doctor. Here you have access to the emergency room and urgent care.
0 copay.
It's a lot of zeros.
Lots of zeros.
And the point, again, that we're trying to illustrate there is that this on a regular Medicare Advantage plan, Carol Lee, they're paying copays on every one of those items.
Copays and coinsurance until they hit an out-of-pocket maximum. I will piggyback on that. I will say that as far as the brand name generic meds, that tends to be sometimes, especially with people who are ill, that tends to be the biggest hurdle is getting their medications covered and covered well and at a lower cost share than originally that they would pay.
Okay, so since you brought that up,
let's do it.
Talk about the cost of prescription drugs on here.
Yeah, and branded generics are going to be 0. And that is the biggest expense, I think, for a lot of the seniors is their medications.
Maria, you're shaking your head, yes.
Mm-hmm. Absolutely. I mean, that's a big cost for a lot of people, not just for the seniors. But
Absolutely.
yeah.
So right there out of the gate, we just took basically every medical expense you could have and told you it's going to cost 0. And you heard Carol Lee say in the opening part of this segment, you're leaving these benefits on the table. Oh, I've got Medicaid, but I have Medicare. Well, you may have Medicare, but you don't have this, okay? And you don't have access to these services, and you don't have the ability to walk into any hospital or any doctor that takes Medicare anywhere in the country, and you're covered.
Mm-hmm. Yep. You definitely are. And I would say, too, especially with the medications being so low, I know I come back to that, but like I said, that tends to be some of the seniors' biggest worries. When you are on a special needs plan, you also do not have to go through the coverage gap. There is no donut hole. There, you do not have to you don't have to do the donut hole.
So yeah, explain that.
Well, typically with Medicare, and you go through it, whether you have a standalone prescription drug plan or it's built into or embedded into a Medicare Advantage plan, everyone is subject to the coverage gap, and that is what is the retail medicine that the carrier and the individual pays for when it reaches, like right now it's $4,660. And then they would go into the coverage gap, which then you would go to 25%. You would have to pay 25% on all of your medications until you hit that $7,400, and then it goes to a catastrophic phase. So with this population who probably needs it the most, they are not subject to that coverage gap.
And as we're going through these benefits, I want to make sure I'm clear. We're giving you this off of the United Health Plan. This is United Healthcare's plan, and this is their model that we're reading these benefits. It may vary with a different carrier, but we have to illustrate this so you understand it. This is the United Healthcare model. United is a national company. They're partnered with AARP, so everybody knows who they are. Okay, but we're using this as our template, as our model, and United Healthcare is a product that RPS benefits by design services and is able to assist people in obtaining for these particular issues. And they vary on state by state, yes?
Correct, absolutely, because Medicaid varies state by state as well.
Yeah, and that's important to understand. So, you know, if you're that Medicaid person, you need to understand that it may be somewhat different where you are. But again, as I said earlier, you know, they can help you anywhere in the country. If you want to call them, 877-385-2224, 877-385-2224. When we come back, we're going to get into the other part of these benefits, the part that's probably going to surprise you the most. Stay tuned. You're listening to America's Healthcare Advocate, broadcasting here on the HI Radio Network, coast to coast across the USA. We've got more. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. We are on 12 podcast platforms. I'm not going to read them all again, but I'm telling you, if there's a podcast platform out there we're not on, I'd like to know what it is. You can find this show on the podcast platform. If you've got somebody in your family, you've got a friend, you've got somebody to go to church with, whatever the case may be, if you know someone that's in need, that qualifies for one of these 3 special needs categories, this is a program they need to be able to listen to, and you need to tell them to go to the America's Healthcare Advocate on the podcast platform, whatever your favorite platform is. We're up there, okay, and you can listen to the show. My producer, Mr. Darren Wilhite, I'm your host, Kerry Hall, in studio with Maria Allers from Client Services, RPS Benefits by Design, Carol Lee Steele and Joyce Thompson, both Medicare specialists and ACA specialists, and we're still talking about Medicare special needs. So we just were talking about this off air, Maria. Let's talk about this again. Somebody they're intimidated by this.
They are.
Yeah.
Yeah, they are. Benefits is not fun for people. I mean, it's very detailed and it's intimidating, and people are afraid to talk about it. But everyone needs it. So whatever your situation is, call us. We have experts to determine what those best plans are. You can bring in your scenario and say, if this happened, how much would I pay? If I get this prescription, how much would I pay? And that way you know exactly what your costs will be. And according to the plan here, the number is 0.
Yeah, and again, they're with you for the journey. They're not with you to sell you like the National Call Center, and then you don't know who the hell you're talking to. This is a totally different deal. You have the same people to go back to each and every time. You told me an interesting story before the broadcast day about a man who called you up.
He called me up, and there was a pre-authorization for the surgery he was going to have on the following Tuesday. And so I went ahead and on his behalf kind of advocated for him with the carrier. And at the very end, we finally got him approved at like 4:30 p.m. And he was like, "Oh my gosh, Carrie, I'm so glad you're my broker, and I'm so glad I have this carrier to be able to get." And so he had surgery Tuesday.
And this goes back to what Maria just said. You got to get a pre-cert, whatever the case may be. They're there for you, and they're going to help you get that done. So again, if you're looking for help, 877-385-2224. I don't care where you're at in the country, they can help you. So let's go through the second half of this, because this is the part that you're seeing on these TV commercials with this teaser about you can get $600 for groceries. So we're using United Healthcare model right now. So let's just go through food, utilities, and over-the-counter per month.
$230 a month to buy those healthy food. Mm-hmm.
That's not available on Medicare Advantage plans. Okay, it's available on special needs programs. That's any one of those 3 categories we've talked about. Dental benefits, and this is huge.
Huge. It's $4,000 for covered types of preventative and comprehensive dental.
Now, contrast that with typical Medicare Advantage plan. It's about
$1,000.
About $1,000.
About $1,000.
This is a $4,000 benefit. Okay, that means if you needed an implant, if you need a bridge, whatever, dentures, whatever the case may be, you've got $4,000 here to work with. All right, let's go to routine transportation.
Okay, 0 copay for 48 one-way rides to and from doctor's office or pharmacies.
Now, why is that important? So it's your mom, okay, or your dad, okay, and you can't leave work again today. My daughter works at Morgan Stanley. She can't walk out the door, because she's got to take Lori or me to the hospital if something were to happen to us, or to a typical doctor's appointment, okay? But if you have this benefit, you've got somebody you're not calling the cab company or you're not calling Uber. You're calling somebody that specializes in medical transportation, that if you're in a wheelchair or you're immobilized or you're in an ambulatory, they'll put you in a van, they'll take you, they'll bring you back. They're there to get you.
They accommodate, yes.
Yeah, and you got 48 of those rides, okay? That can make a big difference. Maybe it means you can just go meet your loved one at the doctor's office or the specialty center or whatever the case may be. But it's a benefit that you would have. Let's go down to routine vision benefits.
Okay, that's a 0 copay on your yearly routine exam, and then you have a $600 allowance for frames and lenses.
Yeah, and that's another one that's very different than typical Medicare Advantage plan, where you've got maybe $200-300.
$250.
Yeah, you've got $600, and then routine hearing. This is another one that's huge.
$3,600 allowance for the broad selection of brand named hearing aids.
Okay, so as we age, those of us that are chronologically challenged, like me at 73 years of age, your hearing starts to go down. I wear a hearing aid. Boom, I've got it on right now. Okay, you can't see it, but I'm wearing it. They're expensive. This thing was $2,500. If I was on this plan, I would have paid nothing because I've got a $3,600 allowance. So again, you've got a loved one. They need hearing aids. They don't have the money. You've got $3,600 here.
And I think it really is, as far as hearing too, it affects their social connections with people. And really makes a difference, that which then also affects their mental health. And so that really kind of just is a piggybacks onto this.
But Carrie, with a hearing aid, you can't use the excuse with Lori that you can't hear her.
No, that's
anymore.
true. You're right. I can't. So that eliminates that excuse now. There's no way around that anymore. There's no doubt about that. And then this has a gym membership, gym partnership available on United. Now here's something I didn't know. I was talking to Marielle Walker at United Healthcare on Friday. We had a meeting. We were talking about some of the stuff. Do you know that they send out a home gym kit to people in rural? I like to fell over when I heard this. In rural communities.
Who cannot get to be members. Yes, they send out the fitness equipment not equipment, but bands and such. And then so that they can do that in rural communities. Some of the gyms are far away.
Oh, they don't have a gym.
Or they don't even have one. Correct.
Yeah. I mean, if you're in Bethany, Missouri, I don't know if you've got a gym or not. Okay, if you're in some of these rural communities, they may not have that facility. If you do, they've got you'll be able to go to the gym. Okay, and it's all covered by United Healthcare. So when you add all of those benefits up, that is a lot of dollars in here. You're talking about $4,000. You're talking about you got 4,600. You got another 3,600. So you're looking here at $7,000, $8,000, almost $8,000 in benefits here that are covered. And then back up here when we get back to prescription drugs, which Maria said that's the single biggest thing, and it is. It's brand name at zero. It's generic at zero.
That's right.
I mean, do you think it makes sense for people to stop a minute and think about maybe this is something we should look for, see if mom qualifies for or dad qualifies for?
And it's one of our highest need populations that really can utilize some of these benefits.
It's really important to understand that, folks. And these people are experts. They'll qualify you. You don't have to do anything but pick up the phone. 877-385-2224. They are happy to help you. Okay, as you heard Carol Lee say, and you heard Maria say, it's complicated, okay? How many hours do you have to go for training every year for CMS to qualify? Is it 21 hours now?
Plus we have to score a 90% on our thing, no matter what.
Yeah, so understand something. This is difficult. This is not easy for people to do, all right? And these folks do this. So you have to do 21 hours of training. You have to take a test, and 70% is not passing. 90 is.
And every year.
And you do this and then you get to go get certified by the carrier.
Correct.
Which is, you're all nodding your heads, which is another glorious 4 or 5 or 6 hours of training to do that.
Correct.
Do you understand why they're experts and how many years you've been doing this? Don't give me your age. I just want how many years you've been doing it.
2010.
Okay. Joyce, how many years you've been doing it?
15.
Okay. And Maria, how many years you've been in this business?
Over 25 years.
Okay. You see, here at this, that's what I'm talking about, okay? These people have the experience along with other staff members at RPS Benefits by Design, and they can help you with this stuff, and they will help you with it. All right, we're going to switch gears here. We've got a short amount of time left in the segment, so I'm going to kind of set the stage. We come back in the fourth segment. We'll talk about this next topic. The omnibus spending bill is going to take Medicaid benefits away from 15 million people. 15 million are going to lose their Medicaid benefits on a state-by-state basis. About 6.2 million of those people are going to qualify for an ACA individual health insurance plan. So the biggest problem that I see, and you're nodding your head, Carol Lee, is they don't know they qualify.
Correct. And I think when they determine if they do actually get then taken off of Medicaid, a lot of them qualify for a tax credit, and that's monies that the government gives to the carrier on their behalf for part of that premium. And so they will qualify, and they may not qualify for Medicaid, but they'll qualify for a tax credit.
Yeah, and don't confuse that with like you don't get the money and you got to pay it and then you get it back on tax. That's not how it works, okay? A piece that I read the other day said the average premium for somebody coming off of Medicaid, losing it, and going on to an ACA plan, an ACA individual, you may know it as Obamacare, whatever you call it, is $10. That's the average they're saying people are going to pay, $10 a month. So when we come back from the break, I'm going to get into that and explain that and talk about how these folks at RPS Benefits by Design can help you. 877-385-2224, 877-385-2224 if you want help. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting on the HIA network, coast to coast across the USA. Stay tuned. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the fruited plain here on the HIA Radio Network. My producer, the always perfect Mr. Darren Wilhite. I'm your host, Gary Hall. If you want to learn more about us, americashealthcareadvocate.com is the website. Lots of stuff up there, lots of information. All these shows are posted, again, on all the podcast platforms. There are 12 of them. I'm not going to read them all again, but you can find the show up there. If you know someone that needs help with these issues, that's where you tell them to go and listen to the broadcast or listen to it with them, whatever the case may be. If you want somebody to help you with either one of these issues, these special needs Medicare programs, or what we're talking about now, which is you're losing your Medicaid in April, can I qualify for an ACA policy? 877-385-2224. They are there to help you. Maria Allers, Carol Lee Steele, Joyce Thompson, and there are other people on the staff as well. But these folks will help you directly with any issues you may have. 877-385-2224. The website is RPS, Benefits by Design, Inc. That's INC.com. All right. So let's talk about this because there's a tsunami coming and it's not a good one.
Absolutely. Absolutely. Well, as of April 1st, first of all, let's back up. People who lose Medicaid, generally it's their income rises and falls, and so they'll get Medicaid or not. April 1st, state Medicaid agencies can conduct redeterminations for people enrolled in Medicaid. Right now, states are not allowed to take them off of Medicaid because of the COVID-19
pandemic.
Yep. And so that'll no longer be in place. So what they'll do is they'll go do a redetermination of what it was prior to the pandemic. So a lot of people are going to be losing their Medicaid coverage.
But again, in the national surveys that have been conducted and were done by, a number of different groups. Kaiser Foundation did one, a bunch of people did. 6.1 million of those people would qualify for an ACA.
Correct.
So talk about, what does that mean?
Well, qualifying for ACA, that is with the Health Marketplace, Obamacare, like you said, however you define that. So those are individual plans or family plans that they may qualify for premium tax credit. What's said is it's monies that the government would give to the carriers on behalf of them for part of the premium because of their income.
And it offsets your premium.
Correct.
So the number that I saw, I believe it was in a Wall Street Journal article, they're anticipating the average premium would be $10 a month. Now, here's the thing. Okay, and I want you to talk about this, Carol Lee. When you're talking about an ACA plan, like a Blue Cross and Blue Shield plan, a United Healthcare plan, an Aetna plan, versus a Medicaid plan, you just stepped up to a far better insurance plan than being on Medicaid, yes?
Mm-hmm. Yes, not everyone takes Medicaid, for one.
Thank you. Mm-hmm. That's critical.
It is very critical. And then also, too, with that having such a low premium, many people qualify for the cost sharing, which means on silver plans, their out-of-pocket and copays may be extremely low, and they qualify that because of income.
So this is a message that needs to get out there, Maria, and people need to know, because one of the biggest pieces of this, there have been multiple articles on this, which is strange, in financial magazines and newspapers like the Wall Street Journal, et cetera, but I haven't seen this out in the general public. You're not seeing this on NBC,
no.
CBS, and it's not out there.
No, it's not. The marketplace, I've had family members that go on the marketplace, and it's overwhelming of information for the ACA plans. Again, call us. Don't be afraid. Call us. Let us help you figure out what the best plan is for you. Let us figure out the subsidy that the government is offering to help offset your premium. Call the number, get a real live person. The other thing I want to point out too is year to year you can speak with the same person. Carolee will know your background. Joyce knows your situation. Year to year you can call them and say, I need help again during open enrollment. And you're not starting all over.
Yeah,
and many times their situation changes,
and
so
there's
they
no
need to
open
know
enrollment here. When you get that letter in April or March, whatever it is, saying your Medicaid is going bye-bye, you then have the opportunity to pick up the phone, right, Carolee?
Pick up the phone and call us, and we'll walk you through. There's a lot of moving parts
There
to
are.
that ACA.
But, and again, this is the thing I really want to get across to people because I don't think they really understand this. This is a step up, not a step down,
Correct.
Carolee.
Mm-hmm.
Okay? This
Absolutely.
is better coverage than what they've got now. Like you said, not every doctor, not every medical facility will accept Medicaid.
Correct.
Okay, and this changes that dynamic. You've got a network now, the Aetna Network, United Network, the Blue Cross and Blue Shield Network, whoever, okay, whoever is offering the ACA plans, and you can move over to it. And that's another thing. They'll see a variety of plans from us, yes?
Absolutely. And we will walk through, picking providers, et cetera. I think a lot for them is with that 6.2 million people may qualify for that tax credit, so not to worry that they will be able to get robust, coverage for them and their family.
Yeah, and it's going to be better coverage than your Medicaid. That much we can tell you for sure. Again, the biggest problem, the biggest hurdle that we see out there is people not knowing that they qualify. Mm-hmm. If you live in a community where you've got a relative, or maybe you're that person on Medicaid, or somebody that's on Medicaid, or they're in your church group or in your PTA, and they tell, hey, I think I'm good. I don't know what I'm going to do. I'm going to lose my Medicaid. Hey, you know what? You may qualify for an ACA plan. Call these people. They'll help you. That's what we're trying to get across today is I don't care where you're at. You can be in Tupelo, Mississippi, or you can be in San Jose, California, or you can be right here in Kansas City, or you can be in Arkansas, whatever the case may be. If you call these folks, they will help you and walk you through the process to get you qualified, because there is a process, right, Carolee?
Absolutely. And Maria is correct when she said that there is a lot of, it can be a very complicated application and, lots of determinations. And that's where we come in, is that we're able to help them through that process.
And that if, you're moving from one government program and trying to get to another, it's not going to be simple.
No, typically not. No. So, but that's where our knowledge base collectively that we are able to assist them.
Yeah, it's going to make a difference. All right. So again, if you want help, 877-385-2224. The two topics today were Medicare special needs and this Medicaid to ACA. I urge you, if you know anybody that's facing that issue, either one of these two issues that may qualify for one of those special needs Medicare programs that could make a huge difference in their lives. Carolee read off all those benefits, zero premiums, all the things from hearing aids to dental to all the rest of it. Take a moment and have them go listen to this show on the podcast. Reach out to the folks at RPS Benefits by Design, 877-385-2224. And now I leave you with this thought from Dr. Martin Luther King. Americans must learn to live together as brothers and sisters, or we will surely perish together as fools. Truer words were never spoken. Thank you for listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA. Goodbye, America.